My name is Tushar Patel. I am affiliated with Lowell General Hospital. I am in a Riverside Medical Group. I'm a primary care physician with Riverside Medical Group. Um, so I want to share some things about COVID vaccine with you all today. Um, First of all, when Pfizer came out with their first vaccine, I went through their entire 48-page document to learn about what went on in their trial and how the trial was done. Because just like anybody else, I was skeptical. I was thinking that it was expedited, and I wanted to make sure that it was done right. And after reviewing the entire document, I am completely assured at the technology that has gone into developing this vaccine. Um, it's somewhat of a different type of a vaccine than we are used to. It's a mRNA protein, which is a spike protein that makes our body develop inflammatory response against this virus. So no part of the virus is being injected in our body. So we can all be assured that there is no possible way to get a COVID infection from the vaccine. As far as the safety of the vaccine, because this vaccine is different than other vaccines, you may develop more side effect from it, but these are all minor side effects. For example, soreness at the arm, headaches, maybe some fatigue, etc. But life-threatening reactions are extremely rare, and only people who have had history of anaphylactic reaction are the only ones we recommend them to have EpiPen with you when you consider it. Otherwise, I completely believe in the safety of this vaccine. How I felt when I took the vaccine, I felt I've gotten both vaccines, by the way. After each vaccine, my left arm felt sore. Even though we supposed to develop a few more symptoms with the second vaccine, for me, my arm soreness was less after the second vaccine, but I did develop a mild headache next day, which I resisted to take even Tylenol for a whole day. But then eventually, since it wasn't going away, I did take a Tylenol. But that was the extent of my side effect. I've done enough reading about Moderna vaccine as well. Moderna came in just about a couple of weeks after the Pfizer vaccine was approved. Moderna is just equally safe vaccine. Again, extensive study was done. Pfizer had 48,000 people enrolled in the study, and Moderna had about 38,000 people enrolled in the study. Again, extremely safe vaccine. There were less than 4 people in each study that developed a Bell's palsy. And that was also, again, as most of you know, Bell's palsy is most of the time reversible. So again, nothing major with both vaccines. They both are completely safe. Highly recommend both vaccine. I do recommend that whichever vaccine you receive the first dose, try to receive the second dose of the same vaccine. If it's Pfizer, it's 21 days. If it's Moderna, it's 28 days. In the end, I would say that I highly encourage every one of you to consider taking vaccine. It's completely safe. As you can see, most of the healthcare providers have chosen to take this vaccine. All of my colleagues have received it, and I highly encourage all of you to receive the vaccine.